So if we want to talk about people who, especially people who inject drugs in the region, we need to know that we are at a high, a high prevalence of people who inject drugs. However, we don't have a good data. The last one showed that we are less than 1 million people who inject drugs across the countries of the region. When we talk about the region for MENAHRA, we're working in 20 regions that includes also Iran, Pakistan, and Afghanistan from the Central Asia. So in this information, we can find also that more than 50% of this group of people who inject drugs are infected by HCV. In some countries, they exceeded 60%. People who inject drugs in the region engage in high-risk behavior, especially in terms of needle and syringe sharing and other issues, and they are suffering from limited services. Of course, we're talking about harm reduction services. Here, I'm talking about a situation assessment that has been conducted by MENAHRA. The report was released in 2018. This assessment showed an increase from 2012 to 2016 in HIV, for example, among people who inject drugs. It was from 15.8 to 23.5 in 2016. And in HCV, it was 36 to 48% in 2012. Then in 2016, it was 20 to 56%. We can see among the 20 countries of the MENA region that are covered by MENAHRA, I mean, we have only 9 countries who are providing a needle and syringe program with insufficient coverage, and 7 countries provide OST, opioid substitution therapy. In some of them, it is a pilot project and mainly in the treatment protocol, not as a maintenance treatment. 10 countries provide general counseling for HIV. This is the package of harm reduction. I think most of you can understand what's this. We can mention here specifically the needle and syringe program, the opioid substitution therapy, the targeted IEC material for people who inject drugs and their partners. We can also mention especially the vaccination for Hep B, testing for Hep B and C, and treatment for Hep C for people who inject drugs. And lately, the naloxone was added. Most of these services in the region are provided by the civil society organizations in a difficult political and funding environment. As I said, the implementation of NSPs in the countries of the region is extremely low. What is delaying the process in harm reduction? First, as you know, the political unrest and wars in some of the countries of the region. Limited political commitment and support means variation in prioritization of HIV and harm reduction among countries and limited funding. Social and cultural challenges, of course, the stigma and discrimination, and sometimes we find that there are some religious barriers among this population. Criminalization and restrictive laws of drug use in most of the countries are behind and that are leading to incarceration. If we do not scale up harm reduction services and programs in MENA, of course, we will witness increase in stigma and discrimination, increase in incarceration for drug use and related offenses, increase in human rights violation towards people who use drugs, increase in prevalence of HIV, HBV, and HCV, and other related diseases among people who use drugs, and increase in death related to overdose. Of course, a delay in implementation, reform of policies. We have some key priority action that we think that need to be done. First, we need to build political commitment, means the governments, the religious leaders, media, law enforcement, etc. Build the case for increased HIV and hepatitis funding, increase knowledge, fight stigma and discrimination, awareness, support, etc. for people who use drugs, make harm reduction services as well as HIV and hepatitis diagnosis and treatment services available, strengthen communities, means like support for the community, enable environment, strengthening the community networks and organizations, and promote community ownership. And last but not least, reform policies towards less decriminalization, adopt harm reduction strategies, and of course, do not punish people who use drugs. The civil society organizations are somehow the frontline workers in this field. They are working in, let's say, targeting 3 pillars. First, of course, they are providing services. They are advocating for policy reform and human rights, and especially they are building capacity and support for community-led organizations and groups. And here I can tell you that in the region we have a new regional network that is called MENAHRA, the MENA network of people who use drugs. MENAHRA is supporting this group, and hopefully this year they will be registered as a formal organization in the region. The civil society is facing challenges. First, seeking innovation in an area where you have scarce data, struggling with the lack of funding. As we said, we don't have political commitment, thus we don't have domestic funding. We are always looking for external support, financial support, I mean. The work of civil society organization is not always recognized by governments, and lacking capacity, especially in hepatitis response. And here I think we need a new era of building capacity of the civil society organizations in the hepatitis issue. We need to remember that countries who adopted needle and syringe programs and OST at appropriate scale witnessed first decrease of HIV, STIs, hepatitis contamination rate, decrease in violence activities, decrease in overdose rate, and increase in the demand for services. Thank you.